It's interesting. Some vegetables, even though they're generally packed with nutrients, can surprisingly disrupt how well your diabetes medications work, or even their safety. This can lead to tricky blood sugar control, or sometimes even dangerous side effects. So figuring out which vegetables might not play nicely with your prescribed drugs is really, really important if you're managing diabetes. Today, we're going to shine a light on 6 such vegetables. We'll explore how they might interfere with your diabetes treatments and help you make safer choices when it comes to your diet. 1. Spinach and kale. First up, let's talk about spinach and kale. We often hear about them as nutritional champions, absolutely loaded with vitamins and minerals, right? But if you're managing diabetes, and especially if you're on certain medications, these leafy greens are something to think about. Did you know that these so-called superfoods could actually complicate your diabetes management strategy? The main thing with spinach and kale is their super high vitamin K content. Now, vitamin K is really important for blood clotting, which our bodies need for healing. But here's the catch. If you're taking anticoagulant medications like warfarin, also known by its brand name Coumadin, which is often prescribed for people with diabetes who often have an increased risk of cardiovascular issues such as heart attacks and strokes, this high vitamin K can be a bit of a problem. You see, warfarin works by inhibiting vitamin K's clotting action to prevent dangerous blood clots. So, if you're eating a lot of spinach and kale one day and not so much the next, your vitamin K intake is all over the place. This can make it incredibly tough for your doctor to get your International Normalized Ratio, or INR, that's a measure of how quickly your blood clots, stable. A sudden jump in vitamin K can fight against what warfarin is trying to do, increasing your clot risk. On the flip side, a sudden drop could raise your bleeding risk if your medication dose is then too high. This really highlights how important consistency is. If you love your spinach and kale and you're taking warfarin, it's not usually about cutting them out completely. Instead, it's about keeping your intake steady and predictable. That way, your medication dosage can be managed just right. It's so important to let your healthcare provider know about your eating habits, especially how much of these greens you eat. Now, vitamin K doesn't directly mess with most oral diabetes medications in the same way, but when you look at your overall health, which might include needing anticoagulants, this information becomes vital. Getting a handle on this interaction means you're better equipped to keep both your blood sugar levels stable and your blood clotting where it should be. This helps you steer clear of serious health complications and take positive steps for managing your diabetes and any related conditions. And as always, it's a great idea to chat with your doctor or a registered dietitian to see how these vegetables fit into your personal treatment plan. 2. Broccoli. Next on our list is broccoli. This is another one of those cruciferous veggies that gets a lot of praise for its health benefits, but it also has a characteristic we need to pay attention to, especially if you're managing diabetes with certain medications. Just like spinach and kale, broccoli is a pretty big source of vitamin K. So have you thought about how this nutrient powerhouse might interact with your treatment plan? Well, if you're on anticoagulants like warfarin, the vitamin K in broccoli can cause similar issues by getting in the way of the medication's job to prevent blood clots. It's pretty simple. Warfarin tries to reduce blood clotting, and vitamin K encourages it. So if your broccoli intake isn't consistent, your vitamin K levels can go up and down, which can mess with your INR and make your anticoagulant therapy less effective. This could mean you're either at a higher risk of clotting, or on the other hand, a higher risk of bleeding if your medication dose isn't quite matched up with what you're eating. And it's not just about vitamin K with broccoli. It also has these compounds called Goitrogens. If you eat very large amounts, these can potentially interfere with your thyroid function, particularly with how your body takes up iodine, which is crucial for making thyroid hormones. Thyroid health and diabetes management are closely connected, you see. An underactive thyroid, or hypothyroidism, can make insulin resistance worse and blood sugar control tougher. Now, for most people with healthy thyroids, the amount of broccoli you'd normally eat isn't likely to cause thyroid issues. But if you already have a thyroid condition, and that's not uncommon for people with diabetes, it's something to be aware of. Knowing this means you can still enjoy all the good things about broccoli, like its fiber and antioxidants, but do it more safely. Often, the main thing is consistency in how much you eat, rather than avoiding it altogether, especially if you're on warfarin. Having a chat with your healthcare provider about how much broccoli you eat will help make sure it fits in with your medication and overall health goals, which all helps with better diabetes management. 3. Potatoes. All right, let's move on to potatoes. They're a staple for so many of us, known for being versatile and that perfect comfort food. But if you're managing diabetes, and especially when you think about how they mix with medications designed to control blood sugar, potatoes can be a bit tricky. Are you really sure how this common vegetable might be impacting your blood glucose levels, and as a result, how well your medication works? The main issue with potatoes is their high glycemic index, or GI, and glycemic load, or GL. This is especially true when they're cooked in ways that make their carbohydrates easy to digest. Think mashed potatoes, baked potatoes without the skin, or fries. These can cause a quick and pretty big spike in your blood sugar. This surge can directly work against what your insulin or oral hypoglycemic agents are trying to do, which is to lower your blood glucose. So, for example, if your medication is helping to increase insulin sensitivity or encouraging insulin production, a sudden rush of glucose from a high GI potato dish can simply overwhelm these efforts, leading to high blood sugar even if you're taking your medication as prescribed. So understanding how to handle potatoes in your diet, or whether you need to cut back on them quite a bit, is really key for keeping your blood sugar stable and making sure your diabetes medications can do their job properly. How you prepare potatoes and what you eat them with can make a really big difference. For instance, boiling potatoes with the skin on and then letting them cool can actually increase their resistant starch. This type of starch is digested more slowly and is kinder to your blood sugar. Also, having a small portion of potatoes alongside plenty of protein and fiber from other foods can help soften that glycemic hit. However, for some people, particularly those whose blood sugar levels are very sensitive or who are on intensive insulin therapy, cutting down on potatoes or even avoiding them might be the best way to go. Keeping a close eye on how your blood sugar reacts after eating potatoes and talking about your intake with your doctor or dietitian will give you that personalized advice you need. This way, you can manage this common vegetable without messing up your diabetes treatment. 4. Sweet corn. Now for sweet corn. It's a summer favorite for so many, loved for its natural sweetness and that great crunch. But it can also bring some unique challenges if you're following a diabetic diet, especially when you think about its effect on blood glucose and what that means for your diabetes medications. Have you ever stopped to think if this seemingly harmless vegetable could actually be making your blood sugar management a bit harder? The main thing with sweet corn is its carbohydrate content, which is quite high and mostly comes from sugars like sucrose and also starch. When you eat it, these carbs break down into glucose, which then heads into your bloodstream. Because of this, sweet corn can cause a pretty noticeable, and sometimes quite large, spike in blood sugar levels, especially if you're not careful with your portion sizes. This quick rise in blood glucose can put extra pressure on your diabetes medications, things like metformin, sulfonylureas, or insulin, which are all trying to help lower and stabilize your blood glucose. So, if your medication is managing your usual glucose levels, a big helping of sweet corn can dump an unexpected amount of glucose into your system that your current dosage might not be able to handle well, possibly leading to those unwanted periods of high blood sugar. Learning how to manage your sweet corn intake effectively is really important to stop these unwanted blood sugar swings and to make sure your medications can do their job. This doesn't mean you have to cut sweet corn out of your life completely, but being aware and having a strategy is crucial. Going for smaller portion sizes is a really good first step. Also, eating sweet corn as part of a balanced meal, one that includes lean protein, healthy fats, and plenty of fiber from other non-starchy veggies, can help slow down how quickly the sugar is absorbed and lessen its impact on your blood sugar. It's also a good idea to go for whole corn kernels instead of processed corn products, like corn syrup or some corn-based snacks, as those can be even worse for your blood sugar. And, as always, keeping a good track of your blood sugar levels after you eat sweet corn will give you great feedback on how your body is handling it. This allows you to make smart adjustments with the help of your healthcare team. 5. Beets. Let's talk about beets. With their beautiful, vibrant color and earthy taste, they're often praised for being packed with nutrients like vitamins, minerals, and antioxidants. However, the natural sugar in beets is something that needs a bit of careful attention if you're managing diabetes with medication. Are you thinking about how this root vegetable might affect your blood sugar and interact with your treatment plan? While beets do have health benefits, they also contain a fair amount of natural sugars, mostly sucrose. If you eat them in large amounts or in concentrated forms like beet juice, these sugars can push your blood glucose levels up. This increase can potentially get in the way of what your diabetes medications are trying to achieve, which is to keep your blood sugar in your target range. For instance, if you're on medication to improve insulin sensitivity or to lower blood glucose directly, a big sugar hit from beets could work against these efforts, making it tougher to get good glycemic control. Figuring out how to balance eating beets with your medication plan is really important, so you can get their nutritional goodness without messing up your diabetes management. Often, the trick is moderation and being smart about how you prepare them. Opting for whole beets, whether they're roasted, steamed, or boiled, is usually better than drinking beet juice. That's because the juice has a lot more concentrated sugar and doesn't have the helpful fiber you get in the whole vegetable, which slows down sugar absorption. When you do have beets in your meals, just be mindful of how much you're eating. Eating them with foods that are rich in protein and fiber can also help lessen their effect on your blood sugar. If you have diabetes, especially if your blood sugar is sensitive to carbs in your diet, it's a smart move to check your blood glucose after eating beets to see how they affect you personally. Talking about how many beets you eat with your doctor or a registered dietitian can help you fit them into your diet in a way that supports both your nutritional needs and your diabetes treatment goals, making sure they're a positive part of your overall health. 6. Soybeans, edamame. And finally, let's look at soybeans, which many of us enjoy as edamame, tofu, or soy milk. They're well known as a great source of plant-based protein and various phytonutrients. While generally seen as healthy, soybeans can have certain interactions that are especially important for people managing diabetes. This mainly concerns thyroid function and how closely that's linked to blood sugar control. Have you ever thought about what eating soy might mean for your endocrine health and your diabetes medications? Well, soybeans have those compounds we mentioned earlier, Goitrogens. Especially if you eat a lot of soy or if you're not getting enough iodine, these Goitrogens can potentially interfere with thyroid hormone production. Your thyroid gland is super important for regulating your metabolism, and if you have an underactive thyroid or hypothyroidism, it can make your blood sugar control worse, increase insulin resistance, and just make managing diabetes harder. Since thyroid problems and diabetes can often go hand in hand, this is definitely something to keep in mind. What's more, while direct interactions between soy and most oral diabetes drugs aren't a huge documented concern, soy can affect how well your body absorbs levothyroxine. That's a common medication for an underactive thyroid. And since many people with diabetes might also be on thyroid medication, this interaction becomes pretty relevant. If your body isn't absorbing levothyroxine properly, your thyroid hormone levels can become unstable, and that can indirectly affect your diabetes control. So, being aware of these potential effects of soy helps you make smarter food choices that support both stable diabetes management and good thyroid health. For most folks, eating a moderate amount of soy products probably won't cause any issues. But If you already have a thyroid condition or you're taking thyroid medication, it's really important to talk about your soy intake with your healthcare provider. They might give you advice on when to eat soy in relation to your medication, or suggest keeping a closer eye on your thyroid function. This careful approach helps make sure that your food choices, including soy, line up with your overall treatment plan for diabetes and any other conditions you might have. So, to wrap things up, while vegetables are, without a doubt, a really important part of a healthy and balanced diet, it's pretty clear that some types can interact with diabetes medications. This could potentially make your treatment less effective or even less safe. But by staying informed about these interactions and working hand in hand with your healthcare professionals, you can manage your diet confidently and safely. This knowledge really empowers you to make choices that support the best possible diabetes control and help you feel your best overall. We encourage you to share this information to help others navigate their diabetes management safely. For more valuable tips on diabetes-friendly eating and lifestyle adjustments, please subscribe to our updates. We also invite you to leave a comment below with your experiences or questions. Your insights could make a significant difference for someone else on their journey.